Dear friends, welcome to our channel. Today, I am excited to discuss the topic of treating type 2 diabetes. While doctors may consider diabetes to be an incurable disease, I am here to inform you that it is indeed possible to effectively manage and even cure type 2 diabetes. Instead of reiterating the common advice of reducing sugar and flour consumption, I will provide you with lesser-known strategies to address this condition. Let's begin with the first step, ensuring an accurate diagnosis of type 2 diabetes. Surprisingly, there are numerous cases in which individuals believe they have type 2 diabetes when, in reality, their elevated blood sugar levels are caused by certain medications they are taking. Various medications such as birth control pills, certain hormones, certain antidepressants, cholesterol medications, and certain blood pressure medications can elevate blood sugar levels. Consequently, it is crucial to examine if your diabetes diagnosis is a genuine medical condition or a side effect of the medications you are consuming. Moving on to step 2, if you are taking blood sugar medications from the metformin group, it is advisable to incorporate a yearly intake of 1 or 2 courses of B vitamins. This practice helps counteract the potential negative effects of metformin, such as poor absorption of vitamin B12. By supplementing with B vitamins, you can mitigate the risk of experiencing symptoms like depression, insomnia, and irritability, which can arise from vitamin B12 deficiency. Moreover, this proactive approach may prevent a further increase in blood pressure, subsequently reducing the need for additional medications. In summary, the initial steps to managing type 2 diabetes involve ensuring an accurate diagnosis and considering the impact of your current medication regimen. By verifying the authenticity of your condition and addressing any potential medication-related blood sugar elevation, you can enhance your journey towards effective diabetes management. The second step in the treatment of type 2 diabetes is to incorporate B vitamins into your regimen. B vitamins not only improve the overall condition of the body for people with diabetes but also enhance the interaction between the body's cells and insulin. Moving on to step 3, it is crucial to normalize your sleep patterns. Going to bed after 1 o'clock in the morning or getting less than 6 hours of sleep automatically spikes blood sugar levels and leads to insulin resistance. Additionally, insufficient sleep has been proven to increase cravings for unhealthy foods, particularly sweets and fatty foods. To address this, strive to go to bed no later than 1 o'clock in the morning and aim for at least 7 hours of sleep each night. Organizing your daily routine to prioritize adequate sleep is essential. Now, let's discuss the fourth step in the treatment of type 2 diabetes. Rather than repeating the common advice to simply eat less sweets and flour, I will share something less cliché. Besides sweets and flour, fast food and alcohol should be eliminated from your diet. Alcohol, in particular, significantly contributes to glucose levels. Sugary drinks such as colas, sodas, lemonades, and packaged juices should also be cut out or consumed minimally. Instead, consider replacing these beverages with alternatives like tea made from blueberry shoots or leaves. Blueberries not only lower blood sugar levels but also strengthen the walls of blood vessels, which is crucial for individuals with diabetes. As for coffee, swapping it for a chicory drink is recommended. Chicory helps lower blood sugar levels, improve pancreatic function, and even has the added benefit of reducing cholesterol levels. To complete the dietary aspect, I have an interesting fact that not many people are aware of. In the treatment of both type 1 and type 2 diabetes, it is advisable to consume slightly more protein. Therefore, your diet should include meat, poultry, fish, and eggs. When preparing meat, poultry, and fish, it is preferable to opt for boiling or stewing methods. Additionally, foods such as porridge, greens, peas, beans, and bran are highly beneficial for individuals with type 2 diabetes. Bran, in particular, not only lowers sugar levels but also helps regulate cholesterol. Moving on to the fifth step in the treatment of type 2 diabetes, it involves incorporating medicinal plants. It is important to note that there is a plethora of misinformation regarding herbs for diabetes on the internet. Therefore, I will only mention herbs that have been scientifically proven to help with diabetes. In addition to chicory and blueberries, which have been shown to lower blood sugar levels, 3 other beneficial herbs for type 2 diabetes are dandelion, beanstalks, and cuff. You can choose one of these herbs and prepare a decoction or infusion. It is recommended to follow this course of treatment for approximately 1 month. After this period, you can try another herb, and then a third herb if needed. It is crucial to find the herb that works best for you. However, it is important to note that you do not need to take these herbs continuously. It is preferable to follow a course of treatment for 1 month, followed by a break of 2 or 3 months before considering another course of treatment. It is worth mentioning that these restrictions do not apply to chicory, as you can consume chicory as a tonic drink daily or switch to it as a regular alternative to coffee. Now, let's address the topic of stevia, a herb that is currently receiving a lot of attention on the internet. You might be wondering if stevia can cure diabetes. Well, I must inform you that there is no proven scientific data supporting its effectiveness for diabetes treatment. Therefore, it is still advisable to focus on the medicinal herbs mentioned earlier, which have demonstrated positive effects. Moving on to the 6th point, it is important to note that it is the most controversial aspect of diabetes treatment. However, despite the controversy surrounding it, it is widely believed that in all diseases, including diabetes, there is a common belief that eating frequently in small portions is beneficial. However, I would like to argue that this is not the case for type 2 diabetes. In the case of type 2 diabetes, it is crucial to strictly adhere to 3 meals a day without any snacking. This is because type 2 diabetes is characterized by not only high blood sugar levels but also high levels of insulin in the blood. In this condition, the beta cells in the pancreas secrete excessive insulin, which is not properly absorbed by the body. When you eat frequently and in small portions, each meal or sip of a sweet beverage triggers insulin production, resulting in elevated sugar levels. Therefore, in my perspective, individuals with type 2 diabetes should eat 3 meals a day with significant intervals between them to allow the body to effectively utilize insulin. I understand that this 6th point may be controversial, and you are free to decide whether to follow this advice. Now, let's move on to the 7th point, which is certainly not controversial. In the treatment of type 2 diabetes, incorporating physical activity is essential for lowering blood sugar levels. Walking is particularly beneficial and has been proven to lower sugar levels. Additionally, activities such as swimming, skiing, ice skating, and climbing stairs are highly recommended. Engaging in calisthenics and strength training can also contribute to lowering blood sugar. However, I would like to mention 2 exceptions to the 6th and 7th steps in diabetes management. If you have recently experienced a heart attack or stroke, these activities may not be suitable for you. For everyone else, you can take advantage of the advice provided today. Thank you for your attention, dear friends. Stay tuned, subscribe to our channel, and take care of yourselves. All the best.